Hi, I'm Gaby. I'm from Essex Equine in the greater Boston area of Massachusetts, and I come down to Florida about 8 months out of the year. Majority of my clients are equitation horses, hunters, jumpers, and eventers. I have a population of dressage horses, of course, and a few Western horses up in my demographic. Probably been using the product for at least 2 years now, regularly. I had been using another extracellular matrix product and thought that I would branch out and start trying another product just because I could use it at the point of care treating an animal. So instead of defrosting and having a single use, that I knew I had to use the product. So I've been very happy with that. So yeah, that's also a really great question. So obviously, anytime you have a soft tissue injury, you've made a diagnosis, defined what the condition is. Really you're trying to expedite that healing phase of either a tendon or a ligament, and to do it in the most optimal way possible. And that basically can include a number of different things: shockwave, lasers, magnets. I'm preferential to doing ultrasound guided injections with these products because I think you're stimulating the cells to kind of go on hyperdrive with all these, proteoglycans and glycosaminoglycans and all the other different products that are inside that extracellular matrix that we're injecting. So I use it like, it doesn't matter if it's like some amateur horse that is just going to be farting around or one of my 5-star horses. It's all the same to each of these people. I mean, obviously the upper level horses, it's a little bit more intense, but they're all valuable to everybody. So excellent. Really happy with how both tendons and ligaments are responding to the use of your product. I use Regeniflex. I've always do intralesional injections with the ultrasound. I follow them up typically at 4 weeks, and for me, I will do a second injection depending upon what I see. A lot of times when I'm tracking these horses that have soft tissue injuries, you'll go through these exponential phases of healing, and then you might hit a plateau, and that plateau, you don't know how long it's going to last. So I try and get aggressive early with these things so that we stay on an exponential healing curve and don't hit that plateau phase. And I think that'll be able to give you a little bit more predictability as far as like how long that convalescence is going to take. I actually had a junior hunter given to me for my at the time she was a 14-year-old daughter, and I had gotten the horse back with Regeniflex, went back, won a big class down in one of the Massachusetts farms, Fieldstone Farm. The horse did great, won, and it re-injured at a high bow. And high bows are particularly difficult because there's a compartmental component to the injury. So meaning once you have swelling of the superficial flexor, you'll also have the palmar carpal fascia constricting that area, causing increased lameness. So you have to be very careful with what you put in. And I think that using PRP in the early stages, especially if it's not leukocyte poor, you're going to have an inflammatory reaction. And I think, we need, as practitioners, we really need to think about this, because if you're creating inflammation with cellular material, whether it's platelets or with white blood cells, which will create more of an inflammatory reaction, you can actually have expansion, significant expansion of that soft tissue structure, which can add to lameness and compromise. So I got a little bit away from using PRP inside superficial flexors like high bows that are, you know, within either the carpal canal or just below it, where you have either that superficial palmar carpal fascia or palmar carpal fascia. And so I started using the extracellular matrix, and I was like, oh my God, like I was profoundly pleased with the results. And so that one horse of mine, Ronnie, came back, competed down here at WEC 2 years ago, dressage, and went lame not long after that, and came sound again with another injection. Of course, it's a re-injury, and has been, knock on wood, sound, and now is jumping little cross rails, and my daughter's still competing dressage. I provided some videos of an ultrasound I did on an Elvis horse, which is a more recent case. Just that horse is doing really well. Came back from a lease and was acutely lame, and so the decision was to do some form of directed therapy, and that's what we chose. And the initial treatment, there was a large defect centrally within that superficial flexor that was communicating to the more palmar aspect of that flexor tendon. And then after 1 month it had sealed down, and then we re-injected it, and the video is showing that even though those fibers had kind of come together, they were still very loosely organized. And I think that's significant in that, you know, you don't want to be a one and done. You're really looking at following up on these horses, maybe not just doing one injection, also not assuming it's a perfect panacea, but rather like, how are we getting to where we want to be in the best way we can? To be clear, I wasn't immediately won over by Hilltop, and that's all. In all honesty, I was used another product for a very long time, and I don't need to name the product. And I was happy with the product. The downside with using that product was that I had to know that I was definitely going to treat that horse ahead of time, so I would have it on my truck to treat it. And because once you de-thaw it, it becomes a situation. And so, you know, in many situations, you're out there and they're like, here's your lameness exam and da-da-da, and you want to treat it and get going with it as soon as possible so that things can get rolling. People have an idea of like how long it's going to take to get that horse back, because ultimately you've got the quality of care for the horse. You've got trainers that need to know if they need to get another horse for these people, or if that horse isn't going to make it to an upper level competition, and where are you going to be? And so these are a lot of questions that I think with sport horse veterinarians are difficult ones to answer, but we're faced with them on a daily basis. So I think that, you know, that time frame, how well it's going to heal, and those are really important factors that. So anyway, I'm very happy with it. I think it's comparable to the other products that I was using. Of course, I think most practitioners, like, once you kind of commit to a product and you're satisfied and you get a consistent response, then there's no need to go searching for something else. You have that relationship with the product, that relationship with the people, and, you know, so there's no reason to move on from that. So I have a very close friend who's out in Colorado whose wife works at CSU, and I won't name names, and she was extremely reluctant to use the Hilltop product. It causes flares and this and that, and I said, I don't know what you're talking about. And I honestly, I think if you use it as per manufacturer recommendation, and you provide proper aseptic techniques and you've got good clinical skills, I mean, I've done dozens, and again, knock on wood, I haven't had any problem. Although, you know, you do enough work, inject enough things, you're gonna have weird things happen with particular horses. I've had, through the years, I've had allergic eosinophilic synovitises to HA. I've had weird polyacrylamide gel reactions after, a month like that I put in the MR. So, the thing is, if you're talking about injecting, thousands of joints and doing these directed therapies, at some point, there's gonna be some abnormality. But I have, knock on wood, I just haven't had that yet. So I'm very comfortable, and I recommend, I don't think it would be any more problem than any other product and I had another product that I used many, many doses of before I moved to your product. Right. Well, the CE opportunities are excellent, and I appreciate that. Thank you. Reps, super great to talk to, kind, nice, approachable. I think those are all things that, as practitioners, whether or not you're doing, 5-star horse stuff, or you just kind of just have a more general population of lesson horses or things like that. I mean, I think we're treating them all with the same amount of care and the value that they have to people and their businesses as well. Just people's sentimental value, business value, competitive value. So I think that's where your company has been really excellent. I think that they recognize that this is a product not just for the elite population of horses and veterinarians. I think it's for all of us.